Hello, and thanks for watching our Ask the Doctor series here at JCPS. The doctors are answering your questions about the COVID-19 vaccine. You've submitted hundreds of questions to us about the vaccine. We're posing those questions now to doctors from UofL Health. And today we are joined by Dr. Valerie Briones-Pryor, who is a hospitalist and has been operating the COVID unit at Jewish Hospital since March 17th, so heavily involved with the information about COVID-19 in our community. So Dr. Briones-Pryor, thank you for joining us. We have lots of questions to get to, so we're going to jump right in. Thanks for being here with us.
Thank you.
All right, so one of the questions we got from our employees, can I spread the virus even after getting the vaccine?
And the answer is yes. So the issue with the vaccine is after your first dose, it still takes about 2 weeks after your first shot to really generate that immunity. So that is actually why it's important to get that second dose. So whether you get the Pfizer vaccine, which is 21 days apart, or the Moderna vaccine, which is 28 days apart, that period of time is still important. And even after you get that second shot, we still say it's about another week before you develop immunity. And just because you have immunity, what that means is that if you contract the virus, you might have either very mild symptoms or no symptoms at all, but you could still potentially carry that and transmit it to others who have not been vaccinated.
Can we talk about the side effects that we've seen from the vaccine? And is there any indication of the long-term side effects of the vaccine?
Sure. Well, the short-term side effects, it's an intramuscular vaccine, which means it goes right into your muscles, so right into your deltoid. And if with all intramuscular vaccines, it is a little sore. You're going to have a sore arm. Kudos to those who don't get sore arms after IM injections, but that is probably the most common side effect of the vaccine is you will have a sore arm. Then there's other side effects as well that other people have experienced to different degrees, and it kind of just depends. So the common side effects listed in the clinical trials were a lot of fatigue, so just not feeling good afterwards, fever, some will have a mild low-grade fever, just some feel achy all over, and part of that is because your body is generating an immune response. And the long-term side effects, we still don't know. Those are things that as we get further and follow the folks who've been in the clinical trials, we'll know better.
So you've had the vaccine and that's how you felt afterwards, the soreness in your arm?
Yes, ma'am.
So for those who have allergies and have allergic reactions or severe allergic reactions to a variety of different things, what do they need to know about the vaccine?
If you have had a severe allergic reaction to other vaccines in the past, or to components of the vaccine. If you have a severe egg allergy, that you shouldn't do that. Now, that's not how the COVID vaccine is made, but if you have had severe reactions to vaccines in the past, allergic reactions, then you really should talk to your primary care physician or provider regarding if it's the right step for you.
And we've been hearing about this new strain of COVID-19 and new strain of coronavirus. Will this current vaccine protect against that as well?
The good news is that this vaccine should protect us against the new strain that we're now hearing about in the news.
If you have particular questions about your individual circumstance, we encourage you to speak to your doctor, your primary care physician about the COVID-19 vaccine. Dr. Valerie Briones-Pryor, thank you so much for being here with us from UofL Health. You've been a great resource to us, and we thank you for answering some of our employee questions. Thank you for watching. I'm Renee Murphy, and I'm glad to be here with you and bring you this important information about the COVID-19 vaccine.